Okay, we might make a start on our next presentation. I'd like to introduce Gatty Burnett from the Northwest Regional Comorbidity Action Group, and Gatty will be talking about the Northwest Regional Comorbidity Action Project, which I believe you've been there for 5 months. I haven't formally met Gatty, but I've heard lots about you, so your reputation precedes yourself. Yeah. So welcome.
Okay. I'm a bit nervous. What do I press now? Green button?
Now, hang on, I've got to click on your name first and then it starts.
So, the Northwest Regional Comorbidity Action Project, specifically Northwest Region. So Youth, Family, Community Connections is alcohol and other drug services. But my job is to link the alcohol and other drug counsellors with the mental health services. So what we do, enhancing the capacity of drug and alcohol treatment services in the Mersey Line region of Tasmania, so they can more effectively identify and treat coinciding mental illness and substance misuse, and connecting rural communities to services through innovative technology and creating conversations around comorbidity. So who here in the room is actually part of the Northwest Regional CAG group? Everyone's like, yeah. That's okay. So there are some people here familiar with what we do. So it is an initiative of Youth, Family, Community Connections. It is funded by the Commonwealth Department of Health and Ageing Improving Services Initiative and the Substance Misuse and Service Delivery Grant Fund. So I'm just going to go over some facts which are probably really boring. But in 2006, the Council of Australian Governments endorsed a National Action Plan on Mental Health, and then they implemented 18 new initiatives under this plan to improve services for people with a mental illness, their families and their carers. So the National Comorbidity Project, they stated that comorbid individuals use more resources and treatment services, have worse psychiatric symptoms, treatment compliance and prognosis, suicidal and self-harming behaviours are more prominent, have fewer financial resources or social supports to assist in seeking effective treatment, have the highest rates of expensive public psychiatric hospital admissions, are generally involved in the criminal justice system, have higher rates of HIV and hepatitis, and adverse health and social outcomes are higher. So comorbidity, so mental health problems can lead to the abuse of drugs and alcohol, increased risk-taking and self-harm, suicide. These needs associated with mental health problems require a multidisciplinary approach. So this may involve alcohol, tobacco and other drug services working closely with mental health services and other workers with specialist knowledge to ensure that comprehensive assessment and interventions are delivered effectively, especially in the rural areas like West Coast, Queenstown, Rosebery, Circular Head. This is really important, especially with the funding at the moment and people not being quite sure whether they're going to be refunded. Some services have ceased down the West Coast, so being able to be outreach down there is really important. So in most instances, assessments and interventions will require a multi-agency approach involving both us and you guys. So ATONs and mental health services regularly provide services to the same group of clients. These interactions generally occur at the operational level and include direct client intervention as well as the provision of advice and support. And to ensure the best client outcomes, the work needs to be cooperatively linked and undertaken with a clear recognition, understanding and agreement about the roles, responsibilities and priorities of each service provider. So we currently have a memorandum of understanding with our Comorbidity Action Group members, which is Youth, Family, Community Connections, MI Fellowship, Mission Australia, Salvation Army Bridge Program, Anglicare Tasmania, Partners in Recovery, Richmond, Fellowship Tasmania, and Standby Response Service. So where Guy is internal, we have a big group pool of people, of organisations that we try to link in to our AOD services. So we also collaborate with other organisations and services. In the Northwest area, there's the Health Services, the Tasmanian Police, DHHS, Kentish Council, Advocacy Tasmania, Health West Zen, ATDC, Tasmanian Department of Education, UTAS, Rural Health, Centacare, Lifeline, Disability Services and TASTAFE, and always welcome to people coming in to collaborate with us. So here's some more boring stuff, the relevant legislation and policies that govern what we do. So the Privacy Act, more relevant legislation, yep. So the protocols to guide our cooperative service delivery. So we enter every partner to the MOU agrees to work collaboratively to implement and improve the effectiveness of the protocols that we have in place. They have been developed to ensure the best possible coordination of services and health outcomes for clients with comorbidity issues. So we would like to have clear referral pathways. So our protocol is to enable appropriate referrals that maximise collaborative efforts for clients experiencing drug and alcohol and mental health comorbid issues. And we use it when a client has been identified, mandated or makes a request. And our procedural steps, so we identify the appropriate service, we inform the client and gain consent as required, consult about referral and establish a timeline, complete relevant referral documentation, and then provide and receive feedback. So sharing information and client involvement. So the protocol is to guide how we will work together with the client as shared care. We use this, well, more than one service is working with the client. And again, it's identifying appropriate services, define and agree roles, including identifying the key contact. We inform the client and gain consent as required, develop a shared care plan focusing on client outcomes and continuity of care. So the client-centred and holistic is really important. Provide and receive feedback and evaluate and review the outcomes. So, case conferencing. This is how we figure out what we're going to do with our client, and the client gets to tell us what they want. So the purpose is to provide a clear case management framework for mutual clients through clear role definition and expectations, continuity of care and appropriate referral and support in order for the best possible outcomes to be achieved. So we use this when the client is accepted into both mental health and alcohol, other drug services. So the original service provider continues to support the client when that client becomes a client of another service. When a client is case managed by both services, a case conference will be scheduled with the client present. The initial case conference meeting should be face-to-face. If not practical after the initial meeting to meet in person, further case conferences may occur via telephone or video conferencing, and case conferencing will be minuted and minutes signed and distributed so that everybody that is involved with the client know what their roles are and responsibilities. What's more? So the minutes are to be identified, significant issues as discussed, progress towards achieving goals, actions, responsibilities, timeframes, and the date of the next meeting to be incorporated into case management plans. So if either service intends to make a referral for the client, the other service must receive prior notification. So prior to the termination of case management with either service, a final case conference will be held to evaluate progress towards achieving goals in the case management plan, development or amendments of future goals, and ensuring appropriate referrals have been made and future resources identified. So if the client withdraws or places on hold the service provided, a final case conference will not apply and all parties should be notified if this should happen. So sharing resources and building skills. So it is capacity building of staff and link services to deliver improved outcomes for our clients. So at our meetings, if training is identified, then we try to facilitate finding that training. When used additional resources, if we need those, raising awareness of available services, and if there is a need to improve communication between services. So by doing this, we maintain and build our NWR CAG networks. We let people know what can be shared. We promote what's available, for example, the training and the resources. We identify and prioritise needs, and we work together to attract resources to deliver training and activities. Okay, consultation regarding change within our group. So the purpose here is to assist effective service provision and relationships between our services. And we use the service plans to make a significant change in structure, service delivery policy or practice that could potentially affect the other services, so the relevant service will notify CAG prior to implementing any significant changes, which will impact other services who are part of the committee. There's a grievance procedure, but... So our e-tools, which is really what I'm all about, I feel, especially down the West Coast and Circular Head. So we have them in King Island, Circular Head, West Coast, and for you guys to be able to link in with clients, you can come in and book out our iPad. We then contact where the iPad is to make sure that's available for you to use. Because with the West Coast, I have had feedback from some of you guys that fatigue and actually being able to get down, so it's a 3-hour drive down to the West Coast to spend an hour with your client and then 3 hours back, and that's your whole day. So that impacts on your service delivery and maybe maintaining your caseload. So by having this information communication technologies in place, it is going to benefit you guys as service providers and also service the clients in rural communities that need to maintain their treatment. I'm just wondering if anybody in the rooms actually use the iPads? No? Maybe we can have a discussion about with rural communities and having information communication technology services like that available, how you feel it might change how you deliver your service for like 5 minutes. Write down some ideas. How does that sound, guys? Yes!
So what was the question again? Just repeat the question.
So it's a rural community, you have information communication technology available. How would it change how you provide the service to that rural community? How would it also benefit you as an individual and your client? Oh my God. I'm talking too fast, aren't I?
Going all right.
My mail inside comes out where
No, I think your pace is quite nice.
You're getting to the point. You're not dragging it on.
yeah.
Getting the job done.
You should have been here on the first day then.
So when it's about, do you want to have question time at the end?
We can.
Okay, so when
We
it's...
want to involve both, go back to what you were doing, if you have questions for you, so we'll do question time at the end, both Guy and I, considering that we have two types of models.
Okay, so we'll leave 10 minutes for that.
Yeah.
When that happens, when there's 10 minutes left, you'll see me going.
How are we doing for time now?
Well, it is 12:23, so you'll have, what's that? But you'll have about 8 minutes when they finish here. Goes quick, doesn't it? Yeah, whiz through them, can't you? Now talk fast. So when you see me wave, that means you've got 10 minutes left.
We should hurry up and email me
Well,
back.
you still got a couple more slides to go, but then sort of start winding into because people will probably want to ask you questions once I get.
Well, it's one like the rural areas because at the moment down in Queenstown,
Got to build on
the midwife services there
thing
don't
to
know
promote the tribune art.
people I work with can't.
That's a way.
iPads can do.
Yeah.
So be able to go refer to them.
What are we supposed to be doing?
Oh no.
How you
Too busy writing little spin.
Busy drawing.
That went down in the scrapbook.
we actually thought
So you're going to do some information sessions, or
Sorry?
you're going to do some information sessions
Yeah,
for the
we're-
community?
Yeah, and at the moment we are.
I'm an idiot.
No,
26
so we have to
weeks
do that.
pregnant, twins, and she's lifting that.
One thing that we're finding that's been requested for grandmothers or grandparents because there's a social community where the son or the daughter has children and they're and then the children
Life without barriers.
that want to
Oh, you said
be able to have them.
do you want me to take him in?
Need everyone knows.
I really like that site.
So we're
That one
about
in
to
the
develop
homelessness.
4 different packages.
And youth projects. I love it. Youth projects one. Are you on that one?
And we're also linking with Vision Australia.
Geez, I read some awesome stuff.
Daniel's not his real name. Well, that's even better.
Trainers and have a discussion, which I think is really, it's all about communication and
No
having that
sugarcoating on this
conversation.
one. Filmed on location at youth projects in Melbourne. This clip shows the background on youth homelessness for many young people.
Hey guys, how are we going? What type of things did we discuss?
appointments to go to and stuff, and might ease the burden of doing a call initially, so you still got that contact,
Yep.
or e-media stuff, we use daily. It's another hour daily.
Who's next?
We have at our table a question, has the service the you are providing already taken up the circumstances of people that are unable to go to from their house to the library where the iPad is stationed, or to the council that is in station? Is there already a possibility for those people to access this kind of services?
Because I'm new, the only access that I know of at the moment is where the kids come from King Island and go to Hellyer College, and they use our counselling services. Then they go back to King Island, so they go because it's at the hospital there. They can go in, get the iPad, and then continue that conversation that they've been having. I'm about to do a big promotion down the West Coast and Circular Head's on Tuesday, to remind people the services are available. And I'd also like to do some focus groups on, if people do want to access them, what can I put in place to make that easier? So yeah, does that answer the question? Yes. Yes.
And listen to people with mental health or other issues that they have in their life, how that can be successfully delivered to them. Because I think that that's a really, really important aspect of what you're offering. You're offering something really wonderful, and if you do have the resources and the funding to follow it through, actually
That's right. It's making sure rural communities are having their needs met. As I'm a sixth-generation Tasmanian, so I have family from Circular Head, and I know that with farmers, the suicide, especially in middle-aged men, is quite prominent. So having the iPads and with is it Raw Alive, making sure that those guys, if they're out in the rural areas, can then link in with us if they need to for that support, because it's also about the workers being supported in what they're doing. Yeah. Any more input?
The barrier just could be that it relies on access to iPad and also training to use iPad, and also training for a worker to effectively be able to build a relationship through media rather than face to face.
Yep.
You know, we all identify face to face is ideal,
Yeah.
but not possibly in a geographically diverse population.
Yeah.
And certainly it's a good use of practitioner time.
Yeah.
In the sense they could see 6 class days as opposed to probably 1. But there are some barriers that need to be looked at. But very great idea.
But what's the cost? Like, you have to have Wi-Fi on if you were in...
So I've covered the cost. So you go into, say, rural health in Smithton, you can book it out, you take it, and we have it set up so that you can use it at home.
The range is good down there?
I do know that the internet down there is quite terrible, but that's, again, a focus group to figure out how we can fix that. Yeah.
I was going to say, personally speaking, I like the idea of a sort of integrative approach where the participant has diversity of mediums. So,
Yeah.
might be able to get online access in person, but I guess I would worry if the stereotypical requirement at the moment they start training workers and replacing computers,
Yeah.
as opposed to it being another option to have, particularly if it's worried about training people.
I can't say that's necessarily replacing workers, because I know with step care treatment plans, that is dealing with clients that might not be ready to do the face-to-face, but they can take the iPad home and use a therapeutic app or an investigative app to inform themselves or start their own treatment in some manner. But that is monitored by the GP or your mental health plan. But I don't think that's replacing the worker. It is a step on their way to recovery. If that's, yeah. Okay, might get back to this. So, as we're talking about the eTools applications, the therapeutic apps are available, which can be used in the step care treatment plans. And examples of these apps are like Mood Gem, Smiling Mind, Happiness Wizard, Drug Facts, and in Smithton, the Learn to Drive app is actually the most popular for young people, because apparently they don't like going into service tests. So, what I do want to do with all the people that have been coming to the conference is actually open up the forum to discuss how we can set up our service provider directory so it better works for you guys and for the clients. And that's once we can get that in place where you can access it easily, and as you're saying, the training around how we can implement that and actually design something so that we can actually streamline it is definitely one of my goals. So I do offer 2 other packages other than the eTools. So we have a package called Creating Conversations Around Comorbidity, which is a Train the Trainer package, and then it's also tailored for schools, workplaces, organisations. So if you have a needs analysis, I have a education worker who can design packages for you or for groups that you may be working with. And I also do the new psychoactive substances. So it's a guide for community service workers. It's developed for workers in response to the increasing needs to obtain knowledge on new psychoactive substances. These new substances have the potential to have a significant effect on the health and well-being of recreational drug users, and that's delivered in an information session. It is also available on our website, at yfcc.com.au. So I'm not sure if you guys are aware, but like bath salts and fertiliser, which are packaged as bath salts, and if you actually know what they do, that you can access, go and buy them and consume them. And so young people are presenting at hospitals, and physicians are not quite sure how to treat them. So we're in the process of trying to update the book as well, but that is available. I'm not quite sure if I'm funded to come up to the north, but I have to see. And question time. I believe I'm funded for the Northwest, but I might be able to talk to my boss and see what I can do. Yeah. Any questions for Guy? So.
It's been a long time since I've been out of the alcohol and drugs for quite a while. And back when I was in there, the psychoactive or synthetic psychoactive drugs were about, but
Yep.
it's developed so quickly. What's because when I was back in alcohol and drugs, well, it was mainly alcohol and cannabis.
Mm-hmm.
Not in Tasmania much of the time. What's the real predominant drug of choice at the moment?
Predominant. We're actually doing our stats for things, but cannabis is definitely still up there, and alcohol is, if talking with our counsellor, he's always saying alcohol first. And we are also in the midst of designing an ICE presentation for different demographics, so be it young people, but there has been the emphasis for us that we hear is for grandmothers and grandfathers to be able to identify the needs of the children. So hopefully we will have packages to deliver after the 30th of June. But yeah, we'll announce it, I suppose, on the website, which is yfcc.com.au. I would hope so. I have seen problems where certain facilities have said, your client needs to dry out before we do a mental health assessment. And that's been definitely a topic of conversation for me the first day I was here at the conference with Frank and David. And it's definitely, that's why with the group, breaking down those barriers and the communication between our services and making sure that it is client-centred and holistic. And I suppose partnerships with how funding is about to start happening, partnerships between ourselves is going to be really important to lean on each other and make sure that the client comes first. And making sure that the treatment, they're receiving the treatment, especially if with ICE, with long-term users that come off ICE, they have a chemical imbalance to begin with, so they have the comorbid, which means we have to work together better than ever if we are dealing with that situation. So, does that answer the question? To come right off it. Okay, my counsellor that I've been talking with, because I get the feedback from them, he's saying it takes about 6 months for the chemical to return to normal. But then I think each individual is different with body types and sizes and things. But Guy might be be able to answer that question. Yeah.
Do you think the government's going to be able to, how they put it as a crisis, do you think they're going to be able to get it off the streets? Like they did heroin years ago in Sydney?
I think this is where the Tasmanian Police should be here to represent and answer that question. I don't know whether the ice will get off how the ice will get off the streets, but yeah, that would be a forum on a different level. How we doing for time? What's time?
Any more questions? One more, two more.
There was an interesting study on AM a few weeks ago. I forget her name, some professor, I think, in Sydney, that actually said that ice use hasn't increased at all in Australia. If anything, it's slightly decreased. But
Yep.
people who are using it, using a lot more of it than the problems.
Yeah.
The way the media tend to blow this stuff up.
I do know what you're saying, but a lot of organisations at the moment are doing their stats. So at the end of June, the task force will wait to see what recommendations are made. But I do know what you're saying. Yeah. Yeah. Yeah.
And so about the media, they seem to seems like down your area, they go all around areas down there, that's where the problems are. So Lonnie, down
Yeah, but we have a great spokesman. His name's Rob Waterman. He likes to have an opinion that's quite large on that. So he's a big spokesman for the Circular Head about ice.
Thank you. I just wanted to say that there's going to be a lot more conversations in the community about ice because it is the issue that it is, and they're putting the money behind it as they should be, as they need to be. And there's a lot more work to be done on it, but there's going to be a lot more information provided. There's going to be much more empowerment for people in the community because people right across the community are not sure which information to take on board. So, like for example, within Anglicare, Anglicare is like a community within itself, and so we've got to make sure our guys are empowered with the right information because they're disempowered at the moment. They're sort of like we're not sure what to say or think. So that's the stage that we're at. Almost right across the community, and I think there's going to be a lot more information and conversations provided to help people out with that.
It's really terrible in the little schools on the outskirts of Tasmania. It's horrendous.
Yeah.
Where there's children as young as 13 years old
Yep.
that have ice addictions,
Yes.
wrapping themselves in plastic and riding down the road.
Okay.
It's horrendous.
It can't happen soon enough, and there's the submissions to the parliamentary inquiry and submissions to the ICE task force. They're all currently happening right now, so the money will be distributed soon, and the action's going to be taken on the ground. So we'll start to notice the actual responses, and it can't happen soon enough. So, yeah, okay. So thanks. Sorry, Gatty.
Just the two more, and then we'll have to stop it there. So.
And that, I think everything that's been discussed now makes it a community problem. It's not just an alcohol and drug problem, it's a mental health issue. It actually spreads out amongst all of our communities. So it involves everybody from NEDA. We need a united response, I guess, to address them.
And that is my comment too about connection to the arts and health sector, and that from my experience within that sector, working within that sector, that
I agree. For the arts, with our parenting programs, I would say, and the after school care, there would definitely be the arts. So, have you heard of the Something Different variety show?
No, yeah, so it's not a specific thing. I was just saying it's more a general comment to say that their arts and health is also something, you know, there's kind of growth in arts and health, and it's an area that maybe to think about connecting with, like to really just stay in touch and like so you can get support for what you're already doing.
Yeah.
How can you get support from them?
Yeah.
They can partner you.
Mm-hmm. Yeah.
More macro, we say it's a lot more dark and open type stuff.
No, I'm saying that there's a growing, there has been, and there's I believe will continue to be a big understanding about arts and health for individuals, for groups, and for ourselves as a society. And it's a wonderful resource, and you can actually see it as something that you can connect to support your own program. Particularly when you look about how you're distributing your funding or how you're choosing resources, that's actually a really good sector to connect to as support for your own section.
Thank you.
Okay, we'll have to leave it there now because it's lunchtime. Thank you, Gatty, for coming along today. I know you said that when you first came up you were very nervous, but I didn't witness anything like that. All I saw was a very passionate and committed person to their program. So as a token of our appreciation, here's a little gift. Gatty will be around at lunchtime, so any more questions, please feel free to approach her. Thank you.